My name's Cassie Kleppel. Today is September 14th. I'm in the 7th semester and I'm doing my insertion of an NG tube. Hello, Mr. Roberts. My name is Cassie and I'm going to be your nurse today. Today we're going to be inserting an NG tube. This is just a little tube that's going to go into your nose and it's going to go down to your stomach for suctioning and feeding. So I would make sure to provide privacy, and I would raise their bed, and I'd make sure they're in a high Fowler's position. Can you tell me your name and date of birth? Perfect. Before inserting the tube, I would make sure I looked if they had any previous nasal surgeries, if they have a deviated septum, how their gag reflex is, and then I'm also going to check the patency of their nares on each side, and then I would have them breathe out and then breathe out. So I'm going to go ahead and put it on the right side. I'm going to go ahead and lay my towel down. This would be in a pre-package, but once I take it out, there. And then to measure, I would start with the tip at the tip of the nose to the earlobe, and from the earlobe down to the xiphoid process. And then once I got my mark, I would mark it with tape. So it's at 50 right now. So I put my tape on the 50 mark. And I'm just gonna get my tape ready for later. I would let my patient know that if they feel any discomfort throughout me putting it in, just put their hand up and tell me what's uncomfortable and I'll stop. So I would lubricate 4 inches. And then I'm gonna go ahead and give them their water because at some point I'm gonna have them be taking sips of water as we're going through. I would inform them that once I insert it, I will have them flex their neck backwards, and then at some point I'm gonna have them hyperextend it down while they take sips of water. So on a count of 3, 1, 2, 3, I'm gonna go towards the other opposite ear, and then I would have them, once it gets into their oropharynx, I would make sure it's not coiled up in the back of their throat. And then if it wasn't, I would keep proceeding and have them sip and swallow as I'm pushing down every 2 to 4 inches as they take sips. And once I hit my tape mark, I'm going to stop. And then I'm going to put a little piece of tape to secure it. And then I'm going to check the placement with a pH strip. Syringe. Make sure to clamp it. I would aspirate for residual, clamp, put it on my pH paper. And then I would look to make sure pH is 5, so that's good. And then my second check would be putting in air. And I would be listening for a whooshing sound over the stomach. Whoa. Okay, and then I would do my checks based on hospital policy, so I also might be doing an x-ray, which is the most accurate method, but I did my 2 checks. Take this off, and then after this is hooked up, I would either hook it up to suction or they're feeding, whatever the order says. But I'm going to put a permanent piece of tape down.
We accept applications twice a year. We're accepting them now. Here the calculators. I washed them and they're all into. Okay, I'm taking. Okay. They're air drying.
And then I would put tape on this. You want to make sure there's enough slack on the tube for when they turn their neck. Okay. And then I would lower their bed. I'd make sure they're comfortable. Again, I would either be clamping it, hooking to feeding, or suction. And then once I document, I'll document what size tube I used, how the patient tolerated it, what number it's marked on how far I put in the tube, and then what type of methods I use to check the placement and if they're hooked up to feeding or suction or clamped.